I've watched the clock hit 4 a.m. in hospital hallways more times than I care to count. It's a lonely hour, and it's when the heart is most vocal. Most of my patients think their blood pressure stays quiet while they sleep. They're wrong. The night is often when the real danger climbs. Tonight, before you close your eyes, I want to show you 3 bedside shifts that do what pills often can't. We are moving at the speed of a whisper. These moves are about giving your nervous system a chance to breathe. We aren't forcing anything. We are simply remembering how to be still. I remember a patient. Arthur. He was 70, stiff as a board, and terrified of his own shadow. His numbers were a constant. Screaming alarm. He didn't need more chemicals. He needed to turn off the internal siren. We did these 3 things. And for the first time in years, he slept. Your arteries aren't just pipes. They have a memory of every stress you've carried today. They hold on to that tension like a clenched fist. Let's start with move 1, the vagus reset. It's the primary nerve that tells your heart it's okay to slow down. It is your body's peace pipe. Lie back. Put one hand on your belly. I want you to feel the breath move there. Not in your chest. Chest breathing is for people fleeing lions. Inhale for 4 seconds. Let your belly rise like a slow tide. Hold it for 2. Then, exhale for 8 seconds through your lips. Very slowly. That long exhale is the secret sauce. It's a biological command to your brain. The day is over. The work is done. You can let go now. Pills manage numbers. But habits like this manage lives. I've seen this simple breath drop a systolic reading by 12 points in 10 minutes. If you feel a little heavy in your limbs, that's good. That's your nervous system shifting gears from fight to rest. You're doing fine. Now, while you're settling in, let's talk about your legs. All day long, they've been acting like heavy anchors, pulling blood away from home. Move 2 is the wall lift. It's the most practical thing you can do for your circulation after a long day of standing or sitting in a chair. Slide your hips toward the headboard. Gently rest your heels up against the wall or the board. Your body should form a soft, relaxed L shape. In the clinic, I call this reversing the flow. You're letting gravity do the heavy lifting for your heart. It's a vacation for your valves. I had a nurse, Sarah, who worked 12-hour shifts. Her ankles were always swollen, and her pressure was a mess by the time she got home. 5 minutes of this every night changed her life. It drains the fluid and lets the heart pump without fighting an uphill battle against the floor. Keep your knees soft. Close your eyes. Your body is a student. And tonight, I'm just here to help you remember the lesson of true relaxation. If you feel a slight tingle in your feet, don't worry. That's just the blood returning to your core. It's a homecoming for your circulation. While you're there, stay quiet. This isn't the time for the news or the radio. This is the time for the silence that a tired heart craves. We're not looking for a miracle. We're looking for a margin. A little bit of space for your vessels to expand and lose their brittle edge. Your heart has beat about 100,000 times today. It's tired. It's done its job. Now, it's your turn to give it a little bit of grace. Stay in this position for another minute. Feel the weight leaving your calves. You are preparing the ground for a very different kind of sleep. Gently lower your legs now. Do it slowly, like you're setting down a sleeping grandchild. No sudden jerks. No rushing the process. Your heart is already beating a little softer. I can tell by the way your shoulders have dropped 2 inches away from your ears. Good. Now, we come to move 3, the Carotid Whisper. This is the master thermostat. It tells the pump exactly when to dial it back. I had a patient named Henry. He was a high-strung engineer, always checking his watch, always tight in the jaw. His numbers reflected it. Henry thought he needed more pills. I told him he needed to talk to his own sensors. Your carotid sinus is a pressure gauge in your neck. Find that pulse right under your jaw. Use 2 fingers. Press as lightly as you would touch a ripe peach. We are whispering, not shouting. Massage in a tiny circle for 5 seconds. Just 5. Then stop. Never do both sides at once. That's a rule we don't break in my clinic. This tiny touch sends a signal to your brain. It says, the pressure is handled. You can open up the pipes and let the blood flow freely. Switch sides after a brief pause. If you feel a wave of calm wash over you, that's your heart rate responding to your own gentle command. Henry started doing this every night at 9 p.m. Within a month, his morning readings weren't a source of anxiety anymore. They were normal. Your body is remarkably good at listening if you know how to speak its language. Most people just yell at it with caffeine and stress. Now, let's talk about the environment around you. Your bedroom shouldn't be a storage unit for your daytime worries or your bright tech. I've walked into too many homes where the TV is blaring and the lights are bright at midnight. That's a recipe for a midnight crisis. Your eyes are the gateway to your nervous system. That blue light from your screen is a chemical lie. It tells your brain the sun is up when your brain thinks it's daytime. It pumps out cortisol. That's the stress juice that keeps your arteries tight and your heart racing. Put the phone in the kitchen. Let it sleep there. Your bedroom is for rest, for healing, and for the quiet work of lowering your pressure. Make it dark. I mean bottom of a well dark. If you can see your hand in front of your face, it's probably too bright for a deep reset. And keep it cool. A hot room keeps the heart working like a dog in the sun. 65 degrees is the sweet spot for a quiet, happy heart. Your body needs to shed heat to drop its internal pressure. If you're sweating, your heart is working overtime while you're trying to rest. I once knew a woman, Martha, who couldn't get her numbers down until she simply turned the thermostat down and threw out her old heater. She called me a week later. She said, Dr. Smith, I haven't slept this deep since the Eisenhower administration. That's the power of cool. Now, let's look at how you're actually lying on that mattress. Gravity is either your best friend or your worst enemy during the night. If you lay on your right side, you're putting a heavy burden on the main vein that feeds your heart. You're essentially kinking the hose. That forces the heart to push harder against the backup. It's an unnecessary struggle that happens while you're totally unconscious. Roll over to your left side. It's a small shift, but it opens up the plumbing. It lets the blood return home with zero resistance. Think of your left side as the path of least resistance. It's a mechanical favor you're doing for your heart while it works the night shift. While you're settling in, consider a warm magnesium soak for your feet. I've prescribed a lot of things, but Epsom salts are a favorite. Magnesium is the original chill pill for your muscles. It tells the tiny fibers in your artery walls to stop clenching and start yielding. I had a patient, Bill, who was a skeptic about everything. He tried the soak and called it the foot bath miracle. He wasn't wrong. It's about oiling a rusty hinge. Everything starts to move quieter and with less friction. Your heart doesn't have to shout to be heard. Now, take a moment to notice your jaw. Most of us carry the whole day's anger right there in our teeth. Let it go. Let it drop open. If your jaw is tight, your heart is tight. They are connected by a thread of tension that runs through your entire nervous system. Relax your tongue. Let it rest away from the roof of your mouth. It sounds strange, but it's a direct signal to your brain to stand down. Your body is finally catching up to the quiet. The pressure isn't a mountain you have to climb. It's a tide that is finally going out. I've sat by bedsides for 40 years. The difference between a crisis and a calm night is often just these 10 minutes of intention. You aren't just a collection of numbers on a chart. You are a person who deserves a night of peace without the shadow of a stroke. Tomorrow morning, when you wake up, don't just jump out of bed like you're being shot from a cannon. Give your heart a minute to wake up. Sit on the edge of the bed for a second. Feel that lightness in your temples. That's not luck. That's you taking the wheel of your health. If you feel clear-headed and steady, you've done the work. You've mastered the art of the bedside reset. You've earned that feeling. I want you to make this a ritual, not a chore, but a quiet conversation between you and the body that has carried you all these years. Share these moves with your spouse or a neighbor. We're all trying to keep our systems running clean in a world that's far too loud. Lowering your pressure doesn't always require a lab coat or a sterile office. Sometimes, it just requires a little bit of common sense. You have the tools now. You have the breath, the lift, and the whisper. You don't need to be afraid of the night anymore. My friend, remember, pills might manage your numbers, but these habits are what actually manage your life. They give you back your own power. I'm Dr. Smith. I've seen the worst, but I've also seen the best results come from the smallest, quietest changes in a person's day. Take one last deep breath with me now. Into the belly. Hold it. Now let it all out. Every last drop of the day's heavy. Dusty stress. The room is cool. The lights are out. Your heart is beating a steady, peaceful rhythm. You are exactly where you need to be right now. Sleep is the ultimate healer if you give it the right environment. You've set the stage perfectly. Now, just let the curtain fall. Your heart is in good hands, your own. I'll be here if you need me. But tonight, you've got this handled. You're doing just fine. Rest well, because you've earned a quiet heart. Good night. Stay healthy, and I'll see you when the sun comes up. We're done for today.